First of all, I'm Barbara Hamm Lee. It is my pleasure to be here with you all this evening. Please pardon my cough and my hoarseness. I've been fighting bronchitis, and so this is the second night I've been out since last Thursday. So we're going to try to get through this, but I got water and a cough drop, so we're going to make it through. Absolutely. So may I call you Tom?
Please do.
Okay. Tom, you and I first met when you were first starting on your film. And your brother was a regular on our show, Another View, and we talked about health disparities. And you're right, it was the beginning of that term really being used out in the public realm. One of the things that struck me about the film that I want to ask you about first is how has the research, the talking to people, the filming changed you as a researcher?
Wow. That's a good question. Changed me as a researcher.
As a researcher, as a doctor, how is it, as a person, how has it changed you as you try to spread this word to everyone else?
Thank you for that question. I should have probably asked you to send me the questions ahead of time. But
that would be cheating.
So throughout, as a researcher, I've always been tied to community, and I've always been in dialogue with the people that I'm doing the research on, as well as the people that I'm trying to reach with the research, policymakers, clinicians, people like that. And so the research has always been informed by what I'm learning from talking to people. And because if you really want to understand what people's lives are about, you got to go into the communities where they are and experience what that life is and talk to them. And they are experts about their reality. And so I've always done that. I think the thing that impacted me the most about it is that I moved out of that neighborhood when I was 18 to go away to college. And then after I went away to college, my family moved out of the neighborhood. So I hadn't really been in Brownsville that much for many years. And I had no idea how I would be received when I went back there, what people would think.
Yeah.
And so I took a chance and I went back. And it was really moving the way that I was received. I mean, I was received, the attitude that people had towards me was, this is our long lost son who's come back to us and who's wants to help tell our story, and people just embraced me. I mean, as you can see, they let me come into their homes with cameras. We were on the rooftops in the housing projects at night talking about their stories inside people's apartments, and they just completely opened up their lives to us and let us come in and tell that story, and I found that really moving.
I think that someone watching the film who may not come from the African American experience will say or may think, okay, but they're poor. That's the bottom line. It has nothing to do with race. They're poor.
Yeah.
Would you talk about some of the stresses, as you were talking about how they were saying it's stressful being a black person? So people would look at you and I as examples and say, well, they made it. They're not stressed. But is that really true?
Yeah. Well, first, why are they poor? Right? So the race predicts the poverty, and the poverty predicts the lifestyle, and the lifestyle produces the bad health outcomes. So it's all part of a chain. And again, this is a series, and I do realize that is what people are going to say. And there will definitely be an episode focused on affluent African Americans and how African Americans that have resources also have health disparities. And this is a constant problem. But here we wanted to talk about social determinants and explain how those social determinants actually get under the skin and produce bad health outcomes.
And some of those same social determinants though can affect a person of color regardless of their socioeconomic status.
Absolutely. If you have more economic resources or even more just educational resources, you may have some tools that can help you to mitigate the impacts of those social factors. But again, over time, that resilience begins to wear. There's only so much resilience we have within our well of resilience. And if you are constantly in situations where you have to draw on those resources, you're going to eventually wear those resources out.
Well, when you're talking to policymakers and people who could address, as one of the experts in the film was talking about, the three different types of racism, the institutionalized racism, policymakers would be the start of being able to turn that around.
Right.
If there is an inherent thought that because it's the poor population, their voice is not as strong,
Right.
as those who have influence, who have money. So how do you convince them that by fixing this, you actually will be raising the bar for everybody?
Well, you have to show that the disparities are not contained. You can't contain it. So the costs, the resources that you, even if it was just the poor neighborhood and the people living in the poor community, well, the city, the state, the government's going to have to expend resources to maintain people in their poverty, right? So maintaining them in their poverty is maybe that may not be helping with the health disparities problem, but it's going to cost you resources to do that as well. So what you have to do is talk about how there are spillover effects, how you can't contain this, how it doesn't matter. The fact that you have health insurance is not going to save you if you get into the elevator with somebody who is uninsured and has tuberculosis. The fact that you have an insurance card is irrelevant. You are at risk, right? So you cannot contain the impacts of having people sicker than they should be simply by saying, oh, well, those are just poor people, and we don't have to give them resources.
How do you address the issue of people saying, but what about the personal responsibility? I loved how you showed at the end the resilience of people and how they were taking on some of that personal responsibility. But to those out there who said, well, if they would just go to the grocery store, if they would just get on the bus, catch 3 buses, go get those fresh veggies and bring them back home, it would be okay.
Right. The human brain likes to find simple answers to complex problems. We like that. There is almost no problem of any significance that can be answered with a sentence that begins, if they would only just, right? Whatever you're going to add is going to be, at best, only a part of the solution. So yeah, personal responsibility is part of it. Sure. I mean, when the rubber meets the road, you have to walk into that liquor store at 9 o'clock in the morning and buy that liquor, right? And the individual does have agency, and they are making that decision, right? But the decisions that you make are not purely a matter of your own individual proclivities, but it's also the conditions that you're living in. So why is Sharon depressed?
Yeah.
What is it? It's his choice. He's choosing to be depressed. Or is he depressed because he is, knowing a little bit more about his story, is somewhat, a feeling of resignation and despair because of the conditions that he's living in, right? So it's that social environment that's impacting your behavior, impacting your attitude, and you do have individual agency. And there are some people, I was fortunate to be one of them, who was able to walk past that liquor store and keep going on to school and getting an education and make it out of the community. But for everyone that does that, there are other people that don't have to do it. And here's the issue. If you live in a community like that, you have to have that extra resilience, that extra strength. If you live in a community that doesn't have those issues, you can make it out without having to walk past that liquor store, without having to develop that discipline.
But what makes the difference? That is something I'm always trying to get to. What makes the difference so that you had the resiliency?
Yeah.
And Sean, who my heart went out to that young man because you could tell that he truly has given up. I mean, in a sense, but he's very intelligent.
He is brilliant.
He really is.
He is a brilliant person.
Yeah.
And
so what do you think is the catalyst?
I wish I had the simple answer because frankly, there were people I grew up with that I always thought were smarter than me, more talented than me, and I thought had, but somehow, they didn't make it through, for whatever reasons. Mm-hmm. Part of it is just plain old dumb luck. We were all in situations where if things had gone differently, if I had turned left rather than right, I would have been in this situation versus that situation. Or if something had happened at the wrong time and I was in the wrong place, I could have wound up in prison and wound up with them. I mean, these were my friends. I hung out with these guys, right? But part of it was just dumb luck. I just happened not to be in the wrong place at the wrong time, and I didn't get caught up in some of the things that they got caught up in. Some of it was that. Some of it also is, my upbringing. I mean, I had 2 parents in the household. A lot of my friends also had 2 parents in the household, by the way. So that is not necessarily the case just because your parents are not married, that they're not both in your life.
Right.
So a lot of them didn't have that. Others did. I had parents that that focused on the value of education, and for me, that was the thing that worked.
Mm-hmm.
But I think a lot of it was luck, religious upbringing, the church. I mean, there's a lot of factors like that.
So I'm going to talk a little bit about the healthcare industry in the sense of we did a show recently on the fact that there are fewer and fewer, particularly African American men, becoming doctors, going into the profession at all, studying for the profession. How important is it that we have healthcare workers who look like the communities that they're serving in order to help them to start really making that change and trying to mitigate some of these health issues?
Yeah, I've actually done some research on that. So what we know is that people, if given the option, people in every ethnic group elect to have a healthcare provider from their ethnic group, much more likely. So everyone does. So African Americans who have the choice to have a black doctor are more likely to select a black doctor than not. Whites who have a choice are more likely to select a white doctor. Asians are more likely to select Asians. Hispanics, every group more likely to select a doctor of their own ethnic group when that choice is available to them. Mm-hmm. The problem is when you look at the production of physicians by race, we simply don't have the production that allows people to make that choice. And so the result of it is that we can't rely on that to solve this issue, where we have to train the entire medical workforce to be able to work with people of all ethnic and racial backgrounds, because we just don't have that. And the reason that we don't have it is that we have a lot of these economic and social factors that we talked about. If you're growing up in a neighborhood like that, you're not going to, your K-12 education is not going to be the kind of education that's going to prepare you, in most cases, in many cases, to go on to college and to go and to get an education that's going to get you into medical school. So that's where it starts. It starts from the very beginning, in the fact that we are not producing a pipeline that is going to produce more health professionals. On the other hand, and this is something I say all the time to my counterparts, people who run programs that train people to go out and do this work, that pipeline argument is not an excuse. It may be, it is a problem. It is something you have to overcome. But in some cases, that's just because, I hear people all the time talking about, we don't have enough minority faculty at our school. And in fact, I was at one university doing a site visit, and I asked them, I saw a lot of diversity among their student body, but I didn't see any diversity on their faculty. And I said, why? What's going on? And they said, well, it's the pipeline. And I said, you know what? I can take that from other places, but I can't take that from you. I said, I look at the courtyard out here, and I see so many Latino kids walking around this campus, working on undergraduate degrees. If you walked out into that courtyard and you grabbed 2 or 3 of them and you said, you come with me, and you listen to me for the next 7 years, I'm going to get you a Ph.D. and I'm going to train you to be a professor, and you're going to be on our faculty. The university is the professor factory. So turn on the conveyor belt,
turn on the belt,
and make them yourself. I mean, that's my attitude. If I need more minority faculty, I go out to the undergraduate program. I say, okay, who are my talented undergraduates that I have here? And I will give me about 7 years, and I will turn you into a person who can be on the faculty at this university with a good livelihood and a good life for yourself. So you need more committed people who are in roles where they will make that decision and do that.
So I know that schools such as EVMS are much more cognizant now of having to teach training or having to train so that people can work with different populations and understand what those differences are and so forth. But is it enough so that if across the country as you go, are enough of the doctors being trained to be culturally sensitive?
Well, obviously not. Progress has been made, with no doubt about that. At least in my time working in this area, progress has been made. I mean, you look at AAMC and what they're doing around, or even just admissions, medical school admissions, is moving less emphasis on organic chemistry, which has virtually nothing to do with the daily practice of medicine. Any physicians in the room? How much organic chemistry do you use on a daily basis? Virtually none, right? It's almost, how much social work do you do? a lot, right?
lot.
But we're using organic chemistry to decide who gets to go to medical school rather than sociology and anthropology or psychology, right? So increasingly we're making those types of changes and moving away from, selection processes like that.
So last question I have for you. Then we're going to open up questions to the audience. So get ready, my audience people. You're ready? Okay. We'll have a mic that will come around to pick up your question. What would you say is the one thing that all of us can do as we start to try to figure out how to lessen the disparity, particularly between blacks and whites in terms of their health care?
Well, what I wanted to do in this episode, what we wanted to do is help people to understand what's happening in their community. So when you talk to the people of that neighborhood, they are extremely sophisticated. They are very intelligent people. There's a difference between being educated and being intelligent. Education has absolutely nothing to do with being intelligent, right? So there are not a lot of educated people living in that neighborhood, but there are a lot of very intelligent people. And they don't always have the vocabulary, which is what education gives you, the vocabulary to express ideas in multiple ways. They don't have the vocabulary, but once you start talking to them about this issue, the brilliance just starts coming out. And they see it. They see what's happening. They see how decisions that are being made, political decisions, economic decisions, they see the conditions in the neighborhood, and that these are decisions that are being made by corporations, by politicians, that either allocate resources or don't allocate resources to that neighborhood. They understand it. And I think that's the thing that I would like to get people to get out of this episode, to understand that the things that you're seeing in your neighborhood have implications for your health, and how it is that these social conditions impact your health. And then by extension, maybe we can think about how we cope with those social conditions and mitigate the impacts.
Do you keep in touch with Sean?
I do.
How's he doing?
Sean is doing well. He has a job now working for the post office, and he's doing really well with that. He's really a brilliant guy. One of the first things he did when I met him was ask me about investing. He said, I'm about to get a job, and so I gave him a book on personal finance and investing, and he's learning how to invest the money that he's making from his job at the post office to take care of his son.
That's great. Questions from you all while you have the opportunity. Beverly, we have this gentleman right here. Let's kind of keep our questions short so we can get many questions in before our time is up.
Check. Thank you for the piece. It was a wonderful movie. I have a question which may be a little difficult. First of all, you're looking at it in this episode, the racial determinants of health disparities. That's what I took from this piece. But all those other things have to be considered too. Brownsville is a high concentration of projects and people jammed on top of each other. I'm still trying to find, as I help our community grow, how do I make race relevant to those for whom it's no longer an issue? For instance, I grew up in the ghetto. It's going to be hard for me to go out into people who are not black and explain to them the impact of race on their lives when both of my children's parents are doctors now. And so how do we address that? We are affluent now. Society's changed. We've had an African-American president. How are we going to continue to say race is a determining factor for all of these ills of our society when there are so many now examples of those of us who've done okay?
Mm-hmm. Okay. Well, we've done okay in spite of racism, right? We've overcome that racism, and that's why even among affluent African Americans and highly educated African Americans, the rates of morbidity and life expectancy is lower, and that still is an issue. But in terms of who's the messenger, we're not. Everyone is not the right messenger for every person who needs to hear the message, and maybe for certain populations you're not the right messenger. And we need allies. We need a broader population of people that are educated and are able to talk about these issues, whether or not they personally have experienced them or not. What I would always tell my students when I was teaching classes about this is that, what we're doing in this class is we're imparting knowledge. So because you are not a racial ethnic minority yourself doesn't mean that you can't learn this. This is content that can be learned by anybody. And that would be my answer to you, that we have to get this content into the curriculum in schools. And when I say schools, I'm talking about not just college, I'm talking about before college, which is one of the reasons why we're even doing this project. That content needs to be there. People need to understand these concepts, and people need to understand that you don't have to yourself have come through a neighborhood like Brownsville to be able to understand the knowledge. It's learnable.
Who else has a question? Yes, ma'am.
Hi. Dr. LaVeist, my name is Tracy Fu. I actually graduated from Tulane International Health and Development in 2008.
So obviously you are brilliant.
Thank you. And I was very touched, by the documentary. Basically, what's going on, what has happened in Brownsville is happening, here in in Norfolk, in our backyard. It's happening in New Orleans, a surrounding Tidewater place. It's also happening in my hometown back in China. As you said, as a professor, if we just work on paper, publication, writing books, our life and work will not be as meaningful. So we really wanted to do more, to make changes. I wanted to learn from you, as you move to Tulane as the Dean of the School of Public Health, what have you done, or what plan do you have, for the next step to change what's going on in New Orleans? The reason we wanted to learn about that is also because we are trying to figure out what we can do to change, what we live here in Norfolk and also back at home in China. Thank you.
So what we're doing in New Orleans, one of the reasons that I even took the job is because New Orleans, to me, New Orleans is ground zero for this problem. If you took the South out and just looked at the national statistics, you would find the disparities would be a lot smaller than they are. The South is the epicenter, and the South is where, when you think of the states that did not expand Medicaid to make Medicaid available to the poor, they're almost all in the South, right? And they're the states with the largest black populations, the states with the greatest need. And in some of those states, hospitals went out of business because they didn't expand Medicaid, like Georgia lost a lot of hospitals. So what we're doing, one of the reasons that I was hired in that job was to not move Tulane away from its global health perspective, because we still are a global school and we do work all over the world, still internationally, but also to become more involved in the local community. The university is a very unique place that was founded because of a very local problem, an outbreak of tropical diseases in New Orleans, right? And then over the years, as the tropical diseases in this country started to subside, they went around the world chasing the tropical diseases, but they forgot that there was two parts to that original mission. It was the tropical disease in New Orleans. And so I was hired to come to remind the school about the New Orleans part of it. And so the projects that we're doing we're doing a lot of projects in New Orleans right now, developing programs for more New Orleans residents to be able to come to Tulane and get an education. It's a great university in a city with great need, but very few local students get to go to school there. So we're building programs in order to get them more opportunities. You're making the university more of an asset for the community. So we recently just moved several $1 million of the university's assets into the local black bank, with the goal of allowing that bank to be able to do lending in black communities. We're working on a project on deep poverty in the lower Ninth Ward, and how we can help develop help create jobs in the lower Ninth Ward so people can get out of poverty. So we have a number of things that we're doing there, but I just came back from Taiwan. We are still working globally, and we're still very active all over the world. So we're doing both. Also partnering with local universities, developing pipeline relationships with Xavier University and Dillard University so that we can increase the diversity of the public health workforce and the medical workforce. These are all things that we're working on.
Who else has a question? Anyone else? Yes, the lady on the edge right there, Beverly. Yes, ma'am. Mm-hmm.
Good evening, everyone.
Good evening.
One of the important things that I saw in this film was the airplane going in the air, and the statement was 230 or 250 passengers disappear. And that's every day, 365 days a year. Yeah. That is too many people to lose. So how do we reach our children? Because I think that's where it has to start. Because one of the things I saw with the young man was just absolute despair and hopelessness. And so how do we work with our agencies, our governments, businesses, et cetera, to reach our children before they get to that point where they are broken and they give up?
Yeah. I would say that we do have to reach the children, but I'm not prepared to write off the adults. I mean, we need to reach the adults too, and it's going to be difficult to really reach children if we don't get to their parents and their families. So the message needs to be comprehensive. The message needs to be to people of all ages, all sizes, all shapes, colors, in creeds, because that's what it's going to require. We got here because of cultural dynamics, the way that we have organized our society, and it is producing these outcomes. We get out of this by reorganizing our society in another way so it doesn't produce these outcomes. So how we do it is we have to change the narrative. We have to, the project like this, the goal is to change the narrative, to get people thinking about these issues, people talking about these issues, realizing that it's not natural that you have these disparities. There is nothing ordained by God at birth that people will die 11 years younger than other people based on what zip code they happen to be born into. Those are decisions that we made as humans, the way that we decide to organize our society. And that only gets fixed if people become cognizant of it. And the thing is that we don't think deeply about these issues. We think very superficially. We say, this person has their skin color is this color, that person's skin color is that color. It must be the skin color that's producing the outcome. We don't think more deeply about it and realize that it's not the skin color. It's nothing biological about any of this. This is entirely social and economic. And, we just need to understand that and respond to that. Because right now, with the diagnosis being wrong, the diagnosis being, there's something about black people that causes them to have more hypertension. Mm-hmm. And you'll even hear physicians say that. I mean, I've had physicians actually say that to me. For a black person, it's okay for your blood pressure to be 140 over 90. And I was like, no, there's no science behind that. That's something you made up. And then we teach it, and then we say it, and they keep saying it, and then it becomes true before you realize it. We have to change the narrative, and the only way we change the narrative is to put a counter narrative out there, and that's what we're trying to do with this project.
There was someone else along that row, Terrence.
Very nice job, a well done film. I particularly like the scene where the young man was running, and you talk about fight or flight, and the impact on stresses that continue over a certain period of time. That was just very well done.
Thank you.
I'm really curious about the whole aspect of internalizing racism.
Yeah.
And how that compromises someone's sense of self-worth.
Yeah.
And I make this statement, and I'm curious because presently I'm working with some young men that are incarcerated at Virginia Beach Juvenile Detention Center. Having worked with adults for 10 years at Norfolk City Jail, Hampton Roads Regional Jail, when I work with these young brothers, it is so completely disheartening to me because they just seem so lost. And I know that it is can be directly attributed to what we're talking about and what you addressed in the film. So I'm curious, have you done any research on the impact of incarceration on health? And will you be addressing that in a future edition of the film?
That's an interesting. I have not done research personally on the impact of incarceration on health. but maybe we should do something in that area. This is a real problem. As you know, the number of, in the book that comes along, we have a chart looking at incarceration over time. And until the 1970s, there was somewhere around 200,000 people in prison in the United States. By today, we're 3 million people. I mean, there's just been this increase over the last 40 years that all come from a series of laws that were passed by Congress that basically created this problem. So I haven't really done research on incarceration and health, but it's an interesting topic. Maybe we should do so.
Now, I know that we have white allies in this room, because every question so far has been where are y'all? You got some questions, because you wouldn't be here if you didn't care about this topic. This young lady right here, Beth, in the gray, with the gray sweater.
Thank you. Hi, Dr. LaVeist. Thank you so much for coming to talk to us. I'm a second-year medical student here, and I was thinking about just your experience of making the film, and I was wondering if you came across anything that really surprised you or that you didn't expect based on all the scholarly work that you've done in the area of healthcare disparities.
I can't really understand that well. You said, did I learn?
Did anything surprise you as you were making the film about
something unexpected that you learned in the process of making it?
That I learned.
Yeah, something that you didn't expect.
Well, one thing is the number of people that are in communities doing good work and trying, and mostly toiling in obscurity. We had a shop where we showed the family teaching people CPR, and she just walks around neighborhoods saying, if she was here right now, you would not be allowed to leave this room not knowing CPR. I'm serious. This woman she is a dynamo, and you just simply would not leave this room. You were going to learn CPR. And she teaches everybody, and she'll just walk up to people, go into some of the roughest neighborhoods, and just say, look, do you know CPR? Well, come over here, let me show this to you. There are a lot of people like that out there that are doing things that you don't know, you don't hear about. They're not seeking attention. They're just doing what they do and trying to make a difference. And there are really a lot of people like that.
Well, we're almost out of time, but Bev, I want to ask you a question since you have the mic in your hand. With Feast, Virginia, you're going into neighborhoods that are food deserts and helping to work with communities to learn how to eat more healthily and so forth. I know there's more to it, but in essence, that's the push of the organization, correct? I see 3 white women, well, white and 1 Asian, women who are going to be going into predominantly African-American neighborhoods because that's where the food deserts are here in Hampton Roads.
Yeah.
How, and this is to both of you, how do you create the trust? Because clearly you're an ally, you believe in this, and you see a need. How do they create the trust in the community so that whoever wants to help can go in and be able to help? Or is there an expectation that you just got to give it time?
Well, I'll let you.
Why don't you start, Beth?
Well, I'm going to start by saying that I spent 4.5 years with a mobile market in a food desert in Tidewater Gardens. I was the one who got the education. It was probably in my life the most extraordinary thing, because here are people that don't have access to fresh fruits and vegetables. So you have to build a relationship, and I don't think it's any different being black or white. It's you build that relationship and that trust that people know you're going to do what you say you're going to do. In fact, I had one of the president of the Tidewater Gardens
Tenant Association?
TMC. Mm-hmm. She looked at me and she said, Miss Bev, people come in here all the time and they do they get their data and then they go away. And they come in here with food at Thanksgiving and they come in at Christmas and then they go away and nothing ever changes. And then she looked at me dead in the eyes and she said, are you going to be one of those?
Wow.
And I said, no, ma'am, I'm not. And since that day, we have formed a very strong relationship. because we trust each other. We can have the conversation. But you have to be willing to do the work and to go into the community and listen. And I think that's what our Feast program is all about, is helping people help themselves where they are and working together and being supportive along the way.
Tom?
So when Bev contacted me, I did not know her. She contacted me pretty much out of the blue and said, I'm starting this organization called Feast. This is what it's for. You know, would you come and participate in our opening? I don't have any money. I can't pay you anything. And, you know, and so right. But why did I say yes? I said yes. It's a one-word answer. It was authenticity. I was convinced from talking to her that she was authentic, that she was really trying to do something positive for the community, a community that I have some ties to, and that place that I've been many times, and that I knew had need. And I was convinced that she was authentic and that she was the real deal, and she was really trying to create something that could have a positive impact. That's how you do it. People will respond to you if you are authentic. When I went back to Brownsville, I'd been gone all those years, I had no idea how people were going to react, whether they would kick me out and say, look, you left us, forget you. That was not at all the way they responded to me, and I think that they responded to me the way they did because they saw me as somebody who was authentic, who was really interested in trying to do something, and somebody who was not going to come, do what we call drive-by research. Drive by, get the research, leave with the data. If you notice, the film starts with me on the subway coming into Brownsville, which is the way you go to Brownsville. You go to Brownsville on the train, but the film doesn't show me getting on the train and leaving. And that was intentional because we're not leaving. I still go up there a lot. I'm still much more connected now than I had been for years because of this experience. And it's the authenticity and the fact that people are convinced that he's really trying to do something positive. He really is trying to help the situation. I think that's what it takes.
Last thoughts that you'd like to leave with this audience? Something that you want us to think about or to do in terms of how we can help to spread the word?
Well, let me take it in this direction. So, Kamara Jones talked about 3 different forms of racism, and we talked about structural racism, and that's the one that gets the most attention. Right. But quite frankly, I think internalized racism is far more serious than structural racism. Because if I can convince you that you are inferior, I don't have to create structures to hold you back. You'll do it yourself, right? Yeah. And it's the internalized racism that is the problem. And I think what I'd like us to do is be thinking about how does internalized racism manifest in communities that you know? And what can we do? And how can we help people to realize that their thinking, the attitudes that they've adopted, have a lot to do with the internalization of these negative messages that we're constantly being bombarded with? And how do we, counteract that narrative? That's, I think, if you take that focus, I think, is the thing that I'd like to see us focus more on.
Ladies and gentlemen, Dr. Tom LaVeist.
Thank you.